Hello, today we're looking at EnerPeel and specifically the application of EnerPeel salicylic acid, which is a 30% salicylic acid predominantly, coming in an EnerPeel carrier system and used for all types of acne, both comedogenic and inflammatory acne. There is strong data where it shows that a sequence of these peels, maybe 2 weeks apart, in 5 university hospitals in Italy, where it was extremely effective at resolving resistant acne, which is acne that had not responded to conventional prescription medicine for at least 12 months. And this is used in conjunction with the Skin OSK creams. Now, the relationship between the EnerPeel salicylic acid and the Skin OSK creams is that both the peel and the cream contain the patented combination of anti-acne ingredients, namely triethyl citrate, ethyl linoleuate and GT peptide 10. But today we're looking at the application techniques. You can see that the client is prepared, the hair is away from the face, the lips have Vaseline on, the eyes are protected, and the rest of the area not to be treated is covered with a towel. Now, we'll go forward and do this procedure. It's about 5 minutes long, and it's a peel whereby the salicylic acid will neutralize itself. So the clinician is preparing the vial, and we're going over it now with the preparatory wipe. Now, these preparatory wipes are quite powerful. They will remove surface lipids from the skin and from any lipids hiding in any little creases in the skin. This is to allow the salicylic acid to work in opening up any blocked hair follicle ducts where the spots would form, and to assist in helping getting the active OSK ingredients to kill the bacteria and reduce the inflammatory lesions or spots. One should be aware that you should always wear gloves when you're doing these treatments, but be aware that those preparatory wipes are powerful enough to take off nail varnish. Now we're about to start the peel. I have a timer on, and you can just see that the clinician is just getting the peel ready. Now you can see, if you just hold that up to me, you can see that the vial is 2 mils of solution, of which half of that is EnerPeel carrier solution, the other half is the salicylic acid with also the Skin OSK ingredients built into the peel. And we're using a brush technique to apply it, and the idea is to get the vial as vertical as possible and draw the peel onto the skin, making sure the skin is visibly damp but it's not running. So you have a piece of gauze in the other hand, so if you do get any runs, then you can catch them with the piece of gauze. I'd also say that I personally would go slightly slower and draw it onto the skin, and make sure you keep it vertical, because otherwise the solution will also fall to the back of the vial. Now you should probably feel some tingling, and we would normally ask the client every 30 seconds to a minute. It's about a minute in now. Can you feel anything, Peter?
Yeah.
Tingling?
Yeah.
Now we often ask on a scale of 1 to 10, where 10 is like having your leg chopped off and 1 is about as painful as the sound of my voice. Where are you at now?
About 4.
About a 4. That's not untypical. If you've got a really big reaction within a few seconds, it could be that the person may be sensitive or allergic to the salicylic acid component. But it takes about a full minute to get a good coating on. You can build that coating on. You can see there is some reddening happening, a little bit of redness as the blood vessels dilate. Not really any swelling. I can't see any frosting, although the clinician will be looking closer than I am. We're now at 2.5 minutes. How are you feeling, Peter? Still around 4 or?
Probably about 6.
6. This should fade away now. As the salicylic acid does its job, it will neutralize itself. In other words, it converts to a salicylate, and it will then become an analgesic, a pain reliever. So the idea is that you get a crescendo of tingling and stinging in the first 30 seconds to a minute, and then if you're assuming you don't keep applying it, then that will fade away. You will often see a white precipitate forming, and I can just see it here on the cheek area. That's not frosting, that's actually salicylate powder. In fact, you can see it appearing all over now, and as that appears, the tingling, I'm going to guess, Peter, is now starting to go down?
Yeah, a little bit.
That'll be about right. So you've now been running 3 minutes now, and you should find that over the next 2 minutes, any tingling goes away. The erythema is fading again, and we'll keep this running for the next 2 minutes. Now, because this neutralizes itself, and we want to make sure that the active anti-spot ingredients from the Tebiskin OSK that's inside this EnerPeel salicylic acid 30% remains active in the skin, we don't use the EnerPeel neutralizer wipes. An EnerPeel neutralizer wipe, which is 12% arginine, is also in an EnerPeel carrier. So that will go into the skin as deeply as the other ingredients and neutralize them. In this particular case, and we're coming around to 4 minutes now, Peter, how are you feeling?
Better.
Better? That's what we'd expect. So we're coming down to 4 minutes, but the EnerPeel neutralizer wipe is not necessary here. We use an EnerPeel remover wipe, which is just a surface-acting, calming, cleansing wipe based on silicone, and really we're just going to clean anything left on the surface, which is the remnants of any of the EnerPeel carrier and the salicylate. So we're now coming around to 4 minutes, just past 4 minutes. How are you feeling, Peter? Is it pretty much faded away now?
It's going down, yeah.
Yeah, the erythema is fading, and I'm just going to go in a bit closer. You can see a bit of the powder on there. That's not frosting. And if I can ask the clinician just to touch an area of the white and between their fingers, you can see that it comes away in the fingers. So that's the powder, it's not frosting. You can get frosting with this peel, particularly if you've got some raised, inflamed spots or lesions, and that can result in where you can actually take the head off the spots, but that's actually a good thing. So we've got 15 seconds, so we're opening up the remover wipe. So we want to open it up as wide open as possible. And we're going to actually blot the skin rather than rub it. The whole principle behind an EnerPeel is you're not rubbing the skin aggressively. So we're now at the 5 minutes, so now we neutralise it the same order as we applied it. So we applied it on the forehead first. So we can do this blotting technique. You can wipe gently. Some people will even squeeze the wipe, because the wipe contains 3 ml of solution, and it's important to get as much of that solution on the skin as possible because it helps to calm things down. And make sure you cover all the areas where the peel was applied, so that we can then apply a sunscreen afterwards. So after this, now the interesting thing with EnerPeel peels is once you've neutralized it, you can cleanse the face with water afterwards. In fact, we advise it because some remnants of the carrier, particularly with the EnerPeel neutralizer, can be left on the skin, and it's nice to remove that before you put the UV on. You will not reactivate the peel. The EnerPeel system means that, particularly with things like TCA and pyruvic acid, these peels are carried into the skin and not left to crystallize on the skin. So the advice you get from other companies whereby they say don't wash your face after a peel, do not apply with an EnerPeel. Hopefully, Peter, you're finding this is all fading away.
It is.
And I'm just going to gently right now. There is some minor frosting there on the top. You can see that's more dryness on the surface. So, but that's quite normal. And what Sarah will do now, our clinician, will with 2 cotton pads with sterile water just cleanse over the area, which you can use cold water as some clinics like to, or you can use body temperature water. It's really your choice. Now this will help open up the pilosebaceous ducts, so it'll be very useful to apply some UV soothe after this, and so that's what we're going to do. If there was excessive erythema still, which this isn't, you might apply something like our post-care creams, which we have a number, which can reduce erythema quite quickly. The UV OSK products also have some calming ingredients in as well. But effectively the main aim now is to apply the cream, and then the client should be good to go. You would recommend they leave with the OSK and the OSK UV and even the OSK cleanser. So this is an acne treatment for clinics only. And what we find is that Maybe not for the rest of the day do they need to apply these creams, because we're going to do the UV OSK now, so they probably start back on their regime of treating the acne from tomorrow morning. Flaking, if you do get it, tends to be 3 to 4 days later, but if you keep using the cream, it's almost minimal, and you'd be the only one to notice, as in the client would be the only one to notice. There is an EnerPeel salicylic acid. How do you feel now, Peter?
Good.
Okay, thank you.